Hi, we are looking at Chapter 10, the cardiovascular and lymphatic systems. It's gonna be pretty fast paced. Your book covers it fairly well, but these are what we're looking at today. We're gonna look at the structures of the heart. We're gonna be able to identify the blood flow of the heart, and you should be able to do this. We're going to look at how heart muscles, the electrical conductions, cause our heart to beat and do its job. We're going to look at the differences between arteries, veins, and their kind of subunits, based on sort of the size, how we name arteries and veins. Arteries being the blood that goes towards the heart, and veins being the blood that goes away from the heart, the blood vessels that take blood away. We're going to talk briefly about blood pressure and how we measure it. We're going to look at some of obviously, the terminology that's associated with cardiovascular and lymphatic systems, including the roots and several key terms. We'll look at the main disorders that affect both the cardiovascular and lymphatic system. We'll look at some med terms associated with this. We're going to look at the lymphatic system to some extent today. It's sort of an introduction. We'll look at this again a little bit more in the chapter on immunology, and we will look at some abbreviations referring to this. And so quickly, we're going to look at these words, these roots in advance. So while we're speaking about the heart, we'll know what we're talking about. So cardi or cardio is referring to the heart. Our atri or atrio is referring to the atrium, the upper chambers of the heart, are the atrium. Ventricule or ventriculo are the lower chambers of the heart, and it refers to those cavities. Valve or valvos, our heart and our veins especially contain valves that are one-way valves. And what it does is as your heart beats, that boom, 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 the blood is forced out of the heart, out through the blood vessel, the arteries, and then you get the suck back. And a valve is a one-way valve that lets blood move forward, but not backwards. So definitely important in arteries. The place that I always think of it being sort of the most visible to us is in veins. When you get older, or if a patient has some vascular damage, the veins the one-way valves don't work as well, and they end up with some swelling in the bottom of their legs. So that's why I always think of the veins. A couple others, angio are referring to blood vessels. Vasculo, or vaso are referring to blood vessels. Arterio is referring to arteries. Arteriole or arteriolo is the arterioles. We'll talk about those in just a second. Aorta, vein, and phlebo is referring to veins. So the term phlebotomy, getting the blood drawn, means to put an incision into a blood vessel. Let's look quickly at the cardiovascular system. Hopefully at some point you will have anatomy and physiology, and we'll be looking at this in greater detail than we can cover in our short chapter. But the entire cardiovascular system is not, we often think of it just being the heart, but it really isn't. It's a series of organs and blood vessels that are interconnected. And so the heart in the center is a very strong muscle. It is designed to receive blood from our body, and it will send deoxygenated blood. Basically, the blood has been used by the cells, and it contains sort of carbon dioxide waste and metabolic waste products, and we have to send it to the lungs to get rid of the carbon dioxide out of our body and bring in some new oxygen. So the heart is designed to first send blood out to the lungs, but also once the blood comes back from the lungs with oxygen in it, the heart is designed to pump that oxygenated blood out to the rest of our body, to all the tissues, to keep us alive. It delivers oxygen and nutrients to cells, and it carries away waste products. So we're going to look at this process in just a minute. So we're going to look at blood vessels, arteries and veins, and some subunits. We're going to look at the lungs, and we're going to look at the heart in some detail. So before we start too much about the system, let's take a quick look at some of the terminology we associate with the heart. The heart is that strong muscle that's located between our lungs, sort of. There's a photograph in the textbook. And it really, the muscular layers of the heart are sandwiched in between two linings. The outside lining is the epicardium. Epi means it's a covering, it's outside, right? And then we have the heart muscle, myocardium. We know myo means muscle, right? So that's the muscle of the heart. And then the endocardium is the inside layers. And we'll see that inside layer is those sort of tightly packed endothelial cells that line the inside of our heart. Pericardium is a sac that surrounds the entire heart, and it protects it. It keeps it separate from the rest of the space within our thoracic cavity. So it's a protective sac that's kind of fibrous and well, protective, and it covers the whole heart. It covers the heart, sits within that pericardium. All right, so let's look at the heart, and then we're going to look at how it pumps around. So let's take a look at some consistencies. So we have 4 chambers of the heart. There are 2 upper chambers, and we call those the atria. So we have a right atrium and a left atrium. And again, we talked about this in the last chapter. You're looking at right here and you're saying, but Andrea, this is on the left-hand side of the page. Remember, imagine that you're standing against the wall and this is your heart and someone is looking at you. This is your right-hand side. So it's your right-hand atrium. This is how it would look in your body. So this atrium, if you locate the heart kind of in the center of your thoracic cavity, the right atrium would be on your right side, and the left atrium is on your left-hand side. So 2 atria, and we have 2 ventricles. The ventricles are the lower chambers here. They're larger chambers. Those are the pumping chambers, and a single chamber is called a ventricle. So we have a right ventricle and a left ventricle. A couple of other things that we're going to look at. We have in between, especially this area here, we have something called a septum. They're walls. They're kind of protective separations that we especially see them between the 2 ventricles. So the chambers are separated by these septum. And we also have a couple of things here. We have some valves. And so these are those one-way valves. So there's a valve here that we call the tricuspid. If you think of the old-fashioned Minutemen hats, the Patriots used to have them as their logo. It's their sort of a triangular shape. That's sort of what this is. This is a 2-dimensional picture of it, so you don't really see the 3-dimensionality of it. But imagine it's sort of like a little flappy triangle piece, and the flap itself sort of opens up. So we call that the tricuspid because, well, frankly, it's kind of shaped like a triangle. We have another valve here. This one's called the aortic valve. Oops, in here, sorry. And we're going to see that in a minute, that's going to be a valve that protects as the blood flows out to go to the lungs. And when the blood comes back from the lungs, we have a valve right here called the mitral valve. Sometimes you'll hear it called the bicuspid. It's not on this picture, but the mitral valve and bicuspid mean the same thing. And so this is the left atrioventricular, the one between the atrium and the ventricle on the left side. What else do we see here? So this is a good picture. Here's the, right here is the epicardium. There's that little thin outside layer. It's a little membrane that lays outside. The myocardium is the muscly piece, and then the endocardium is this thin inner layer that lines the muscle. A couple of other major terms you may start to see are the apex. Apex just means it's the point at the bottom of the heart. And so in the heart, the apex, or the pointy part, faces down. It faces to our inferior or downward, lower side of the heart. Other things are some of the important blood vessels we see here. Oops, we went ahead a little there. We see the aorta here. The aorta is a really, yep, nope, that's blue, that's not. That's a vein. Sorry, that's an artery, but it's blue. So we'll talk about why in a minute. The atrium is this one. It's the arch-shaped one. I was looking at the arches here. I was thinking, oh, that's what I was looking at here. But it's an arch-shaped blood vessel. It's really large because it has to push a lot of blood out of your heart. We're not going to talk about the structure of arteries versus veins, but you'll see this artery, this incredibly large artery, with some branching that goes off, right, is very, very strong. The layers of arteries can withstand a very high blood pressure coming out of your heart. So arteries are sort of thicker and a little bit more sturdier blood vessels than veins. And then last two things. This large blue one, and we put it as blue to designate it as being oxygen poor blood. This is the vena cava, and it comes from two different places. We have a superior, or from the top, like if you think about it, if you have a boss, they're your superior, they're above you, right? Not in spirit, but on the organization chart. So the superior vena cava brings blood sort of from the upper part of your body, and the inferior vena cava brings it from the lower extremities. They both dump in to the right atrium. So both of these dump blood into both sides of the vena cava, meet, and they dump blood into the right atrium. We're going to just go around and look at this. The blood comes in through the right atrium. It pushes through the tricuspid valve here into the right ventricle. It goes up through, going out, and it's going to be going to the right ventricle. It's going to send it through the pulmonary valve. The pulmonary valve is the one, pulmo means lungs, so the pulmonary valve is the valve in the heart right before you send the blood out to the lungs. And so, again, it's a one-way valve. The blood goes in, the valve shuts, and the blood can't suck back into the ventricle. So the blood is going to go out into the pulmonary artery. And you're saying, Andrea, that artery is labeled blue. I thought arteries were red. Well, the pulmonary artery is the only artery in our body that carries deoxygenated, used blood, right? That is carrying carbon dioxide back to the lungs. The lungs would be over here and over here. So you have a left and a right pulmonary artery, comes out through the pulmonary valve to the left pulmonary artery or to the right pulmonary artery. Over here would be the lungs. The exchange of carbon dioxide and waste products, especially in the form of kind of water, will leave your body, and then it comes back to the heart. What kind of veins come back to the heart? They come back as blood vessels come back to the heart. Towards the heart are always veins. So we would see a pulmonary vein coming back to the heart, and it would dump it into, there they are right there. That's the left pulmonary. We don't see the right pulmonary. Oops, that's supposed to be right there. It's supposed to be showing that it's, nope, let's see, the vein. I don't see the right pulmonary vein. They don't have it pictured here. But the left pulmonary veins and the right pulmonary veins would dump blood into the left atrium, goes through that mitral valve or the bicuspid, into the ventricle, the left ventricle, goes back out through that aortic valve, the last one-way valve, through the aorta, and it goes out to the rest of your body, to systemic blood vessels. So let me go over this just one time really quickly. So blood comes in from the superior and the inferior vena cava into the right atrium through the tricuspid valve, into the right ventricle, out through the pulmonary valve, into the pulmonary arteries that'll go to the lungs, left lung or right lung. There, oxygen gets blood cells drop off carbon dioxide and we breathe it out, and we pick up oxygen and it brings it back to the heart through the right vein, the right pulmonary vein, and the left pulmonary vein. The right and left pulmonary veins drop this newly oxygenated blood into the right atrium, through the mitral or the bicuspid valve, into the left ventricle, where it goes out the last stop through the aortic valve into the aorta, where it gets pumped out to our body. We hear that, as I said, one-way valves force the blood to keep going forward, and the heart sounds that we hear, that boom, 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 are those valves closing, and so they coincide with the beating of the heart. So the heartbeat itself. This is a good picture. So there's the left pulmonary veins and the right pulmonary veins coming back. Okay, so how does the heart beat? The heart beats through a series of electrical series of what do I want to say? Transmissions, electrical transmissions that tell your heart either to contract or to relax. So contract is exactly what it sounds like. Everything tightens up, the muscles tighten up, and so the heart pulls in, and it will contract the heart, and then we call that systole, and then diastole. Systole or systole, I say systole, or diastole is the relaxation phase of the heart. And so I don't think, yeah, we'll talk about this in just a second. And so what we're going to see happens is the heartbeat starts with a joint contraction of both atria at the same time. Both of them contract. The blood starts to move through. The one goes through the one-way valves, and then the heart releases. And that's sort of a rest phase. So the contraction moves the blood through, and then we relax. Contract, release, contract, release. That's what we hear in our heartbeat. A couple of things we're going to look at so that we can talk about how the electrical impulse happens. We have these areas, these sort of just groups of cells that we call nodes. And so we have a set of nodes at the atrioventricular axis in between the two, the atrium and the ventricles. We also have something called the atrioventricular bundle, or the AV bundle, and we say it's a bundle of HIS. And what the AV bundles are really is just it's a group of tissues that are going to help, a group of cells that are going to help us move the contraction is going to happen. And we're going to talk about how those groups of cells are going to do their job. The atrioventricular, that's hard to say 3 times fast, atrioventricular bundles kind of go out into smaller areas. They get smaller and smaller, sort of like arteries, and arteries and arteries are big, capillaries are small. The same thing. So we're going to have there's sort of branches of bundles. So we start with the AV node, which are just those cells, right? Then we bundle them together to make this bundle of cells, basically, bundle of they're fibers. It's like a cable. It's like the cable company. It's a bundle of fibers. And then you have these little teeny offshoots, and we're going to make sure those are branches. So there are bundled branches. So we have the node, and then we bundle up a bunch of those cells that are made into fibers, and then they expand out into these little small branches, and those are all going to work together. There's one last set of fibers here that come from these AV nodes to the AV bundles to the AV branches. And then we have the Purkinje fibers. And Purkinje fibers are the ones that ultimately deliver the electrical stimulation that starts in the node to the fibers of to the muscles of the heart that make it either um, um, contract or release, is the delivery of the messaging. So let's take a look. Your textbook has a nice discussion about this. It's short, but it's nice. And so, how do contractions start in the heart? Um, they're stimulated first by an electrical impulse that starts in the SA node or the sinoatrial node. This is located in the upper right atrium, and we call the SA node that up here in the, oops, there it is, the SA node, we call that the pacemaker because it's the one that node is going to keep our heart on rhythm, the right rhythm. We also have, so the SA node, it starts with the SA node and then it is going to trigger the atrial ventricular nodes to carry the stimulation from the SA node down through those AV bundles to the bundle branches to the Purkinje fibers. And the fibers, the Purkinje fibers, are going to signal the muscle in the cell walls of the heart to contract, and then the electrical stimulation releases and the heart will release. So that's the basics of cardiac stimulation and contraction. Let's talk about the vascular system. I told you just a minute ago that arteries always are named for the blood that moves away from the heart. It is typically blood where the blood cells, the blood-carrying red blood cells, are filled with oxygen from when we just breathed in. Remember, the one exception to this are the pulmonary arteries. The blood is still being carried away from the heart, going to the lungs, but it's deoxygenated. So it's the only blood vessels, the pulmonary arteries, left and right, are the only blood vessels in our body that are arteries that carry deoxygenated blood. Okay, so big blood vessels that carry oxygenated blood are called arteries. They get a little smaller. They're called arterioles. Veins are the ones that carry blood back to the heart. Remember, pulmonary veins, left and right pulmonary veins, are the only oxygenated veins in our body because they're carrying oxygenated blood from the lungs back to the heart. Pulmo means lungs. And so just like arteries are big and arterioles are smaller, veins are bigger, venules are smaller. That's a little bit backwards. It should say veins and venules. And so in between this comes capillaries. Capillaries are a mix of capil, C-A-P-I-L, is referring to hair-like. And so they're very, very, very small blood vessels. These very small blood vessels are partially oxygenated, partially deoxygenated blood. They're sort of a mix. And so your textbook does not have a nice picture of it. I should have thought to put one in, but they sort of meet in the middle. And so if you have an artery like the aorta, right? It's not the only artery in your body, but the artery carries blood away from the heart. They go into smaller arteries called arterioles. They move into the capillaries. They're still oxygenated. In the capillaries, this is where you see most of the exchange of oxygen and carbon dioxide inside the blood vessels, right? This is where we see that happening. Doesn't mean in these blood vessels you can't have some exchange, you can, but this is really the site where we see that all the work in the tissues happening. So the capillaries drop oxygen off to the blood, to the tissues to go feed the tissues, right? They're going to give them oxygen and other nutrients. And then the cells that are using the oxygen, the tissue cells, they produce carbon dioxide and other metabolic waste products. That goes through capillaries also. They move back into venules, out to veins, and out to the lungs. So, sort of the pass through of the vascular system. We have a lot of arteries in our body, and they're named typically for the site where we are. So you have one, your temple is the side of your head right here. People have headaches there sometimes. So the temporal artery is there. You can see the blue ones are, we're in veins here. You can see the blue ones are considered veins. When they start to be this kind of purpley, color, then we're starting to think of them, although this one is not. I was hoping they had a capillary here. Usually in pictures like this, blue is considered for veins, deoxygenated, and red is considered for oxygenated, and then we see sort of a reddish-blue mix for capillaries. But, we saw the iliac on the hip, right? So we have the common iliac, right? So if you're looking, radial refers to the radial muscle. The radius here on the arm. Brachial up here, we saw a brachial muscle last week. So brachial, we're going to remember that one because this is a site in the brachii, arteries and veins. This is where we're going to be doing some blood pressure monitoring. Yeah, I was looking, I thought maybe I had a picture of the arteries and I don't. And so when we're talking about the heart, blood vessels, we can't miss talking about one of the ways that a physician monitors people's heart health, and that's by a patient's blood pressure. They monitor someone's blood pressure. And blood pressure, quite simply, is just how much force is needed that as the heart pushes, how much of it's the force exerted against the wall of a blood vessel. Lots and lots of things can influence what someone's heart condition is and what their blood pressure is. Things that influence it are the size of the blood vessels. We're going to see some conditions in a few minutes. Blood vessels think of them like a straw. They have a hollow area, right? And then they have the cells that outline it, and the cells are designed to keep the blood inside the blood vessel, right? So your blood vessels are just like a little straw, and so it has a very small hollow opening in it. The diameter, how big or how small that opening is at any given point in time, can influence our blood pressure. And so blood vessel diameters change with how strong the heartbeat is, how hard your heart has to work to push the blood around your body. Someone who's overweight may have their heart has to work harder to push it because there's more tissue in the body to try and move blood around to keep it alive. And so blood vessel diameters will constrict. They get smaller and they will dilate. They'll get bigger, and that helps move the blood along. So as the heart pumps, boom, 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 the blood vessel diameter changes from bigger to smaller, bigger to smaller. It's an autonomic reflex that just keeps the blood moving along. Other things that influence your blood pressure is how much blood volume someone has. And this is often related to how hydrated someone is, how much water and fluid they take in. We'll see kidneys will also influence kidney function, what the health of the blood vessels are. So lots of things will go into changing the health of someone's blood pressure, but it usually starts with how well your heart is working and how well your blood vessels are able to react to that by constricting and dilating. Other things as you go along. I think everyone probably knows what a blood pressure cuff, a sphygmon. We've already had this discussion that I butchered this since I was 20 years old. because I always forget the MO in the middle. I skipped a fig manometer, and there's an extra mo in there, so I have to read it. Sphygmomanometer. You and I can do that together. A sphygmomanometer is designed to measure two things. And so when you get a blood pressure, you have the first number, and then there's a second number. So someone will say, your blood pressure is 123 over 75. The 173, the 123 is the top number. That's systolic. The systole, the contractions, it's measuring the contractions. The lower number is the release, the diastolic. And so we measure both systolic and diastolic pressures. We'll look at this in just a second. And we were just talking about the brachial vein, but in the same area, I said to make sure you took note up here in the brachial area. We're going to look at the brachial artery. Typically, is the one where we're going to measure. It's a nice big vein. It is easy to identify, and it's a good place for measurement. It's kind of a standard measurement. I just had a thought about arteries and veins, and I just lost it as I was talking. What was I thinking of? Arteries, I should also just mention, versus veins. We draw blood from veins, not from arteries. Veins are more surface, and arteries are typically deeper. They're embedded within sort of muscle, or they're embedded within tissue, I should say, not muscle. Well, they are in muscle, but capillaries are muscle. But it's embedded within tissue to kind of hold those arteries in place and to aid in the pumping of blood. So arteries tend to be a little bit deeper, and so the brachial artery is a nice one that it's deep enough to be sort of held in place the way it needs to be for functioning, but it's accessible enough for us to be able to measure blood pressure. So let's look at, and your book does discuss in a little more detail on page, let me just say, on page, no, I lost it. Page 321, you can look a little bit more about blood pressure and what it means, but really, a typical, I think people always worry about the top number, the systolic, but really people have to really worry about how well your heart relaxes too. A lot of times it's the lower number that tells a story. So typically, a normal blood pressure is, going to have someplace around 130 and under for the systolic number. 130 is like upper edge, and the lower number should always be, under 90. Once it hits 90, your doctor's going to want to talk to you. Anyways, you'll learn more about that depending on what program you're taking. So I think let's just look at all these key terms. I think we talked about all of them. I'm just going to make sure we did. Coronary circulation versus so coronary circulation is just all the blood vessels that are involved in arteries and veins, right? Depolarization, we didn't talk a lot about this. So when we talk about making a contraction or a release of the heart muscle, it's interesting. It goes back to when we talked about 2 weeks ago, we talked about muscles and the role of actin and myosin and how muscles contract. And so heart muscle is impacted the exact same way. It's autonomic, but it's still muscle and it has to contract in a certain way. And so when we talk about the contractions of the heart, we will talk about, first it's sort of the messaging gets sent to the muscle. So there's that, within those nodes, we get that message that sends to tell the muscles to release acetylcholine, that ACH, acetylcholine, the hormone, right? And what acetylcholine does when it binds to receptors on muscle, like heart muscle, it tells the muscle cells to do a couple of things. It tells the muscles to take in some of the sodium that's being carried by the blood. So we have an ion called sodium. It's an important ion that typically is outside of our cells. The ACH will tell the muscle cells to suck in some sodium. And it will also trigger calcium to get released within the muscles as well. And when the calcium releases, we have those two fibers, the actin and the myosin. The myosin was the head, right? We had the fibers with the myosin at the head. And the myosin head of the muscle will attach to the actin threads, those interwoven ones, and that muscle myosin head attaching to the actin, do you remember what that did? Made the muscle contract. And so that contraction is that first cycle that we saw, right? The contraction, then the release. And it all starts with an electrical charge we call depolarization. It all gets back to there. We haven't talked about ECGs yet. ECG, just like we can look at blood pressure to monitor the contraction and release of the heart muscle, the systole and diastolic. But an ECG looks at the electrical heartbeat, the electrical conductivity of the heart that occurs when we see sort of this depolarization process. And so an ECG or an EKG, you'll hear them both, looks at the electrical activity of the heart. A murmur, remember I said the heart sounds that we hear, that boom, 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 is typically, valves closing and opening. You can hear a murmur that, makes it so the sound doesn't sound quite right. It's a little quiet. It's not quite sort of functioning the way it needs to. And usually a mild murmur is nothing that people have to do. They just watch it. But it will be the functional murmur is what we expect to see. If you see an abnormal murmur, it's one that we think sounds funny. And sometimes you'll hear your physician or a physician will hear a patient's valve that when they hear that the closing, it doesn't sound like shutting it, it doesn't really sound like shutting a door, but a valve shuts the door, right? So the blood can't flow back. And if the valves aren't working properly, you hear kind of a leaky sound. So instead of it being kind of a boom, boom, it's like a boom, boom. And it hears like it extends it out a little, much not that extensive, but I'm using it for observational and demonstrable purposes. So that's what they listen for the heart. They listen to hear that the heart is functioning properly. So we talked about that. The loudest sounds are the closing of the valves. The inferior and superior vena cava. We talked about the valves. We talked about all of this. The pulmonary circuit is just the blood vessels that leave the heart, go to the lungs, carry oxygenated lungs back to the heart, and it goes around and around and around all day, every day, without stopping. Repolarization is, so I just told you how the myosin head binds to the actin fibers to cause a contraction of the muscle fiber. Repolarization, that's through depolarization. Repolarization brings it back, and so that process is reversed. We've talked about all of this. The system circuit, systemic means body-wide. So a systemic circuit is everything from the heart, bringing all the blood out to the tissues in your body, bringing the deoxygenated blood back, and sending it back out to the lungs, pick up some oxygen, bring it back, and recycled. So we see the systemic circuit, it's everything that goes all the way around. Let's see. Okay, let's look at some of the clinical diseases we see associated with it. They don't like to call it disease. Clinical aspects of the circulatory system. Again, your book, you're going to see there's a lot. Your heart's an important an important muscle, and it's an important process in our body. So let's talk about it. One of the most common ones that we see is something called this is hard to say also, arteriosclerosis. Say that 3 times fast, I dare you. Arteriosclerosis. This is an interesting one. Remember, I just told you the blood vessels are like a straw, right? They have that inner kind of part, that diameter, that you know empty spot um, is what we call the lumen of the blood vessel. The lumen is the empty part. It'd be the inside of the straw. And how big or small that is an important part to how well your cardiac system works, right? So imagine that you had plaque or fatty deposits, especially that bad cholesterol, that LDL. Sounds like it should be good, but it's not. Imagine you had a straw and you had plaques or deposits of fat all on the inside of it. What does that do? It reduces the lumen side. It makes it smaller. Means that the heart has to work harder to send that around, to push your blood around. Um, but it also means that you can end up with not being able to deliver enough blood to all the tissues in your body. And when the blood flow to a tissue is impacted, we call that an ischemia. Where do we have problems with that? Well, imagine that the blood flow to your brain isn't working properly, or you had a blood flow reduction to your lungs, right? Ischemia anywhere can be a problem, but obviously, if you have it to the brain, the end product. If you don't, what happens if you don't deliver oxygen and nutrients to the cells of the brain or the lungs or the liver? What do you think happens? The cells die, right? And so, arthro, I can't even arthro. I keep wanting to put an L in there. I'm going to read it because this is. Don't get me started trying to say multiple sclerosis. You could just hear me say it. Atherosclerosis is obviously an issue that we worry about not sending enough oxygen to our body's tissues, and people end up having ischemic attacks, loss of oxygenation to a part of their blood, to their body tissues. What kinds of things that we are going to be associated with um, atherosclerosis? Lots of lipoproteins. These are proteins that have a fatty piece attached to them. They're high cholesterol, right? We call it a dyslipidemia. It's a disease of lipoproteins, right? Too much. People that smoking, um, you know, breathing in smoke in through your lungs. Smoking damages the ability of the blood vessels to be able to constrict and contract, or dilate, constrict or dilate. High blood pressure, remember how hard it forces it through, causes you to, you may end up with damaging your blood vessels and not being able to deliver blood appropriately. Poor diet, well, you need to feed yourself, feed your body, feed your health, right? Inactivity, stress, family history, lots of things can cause atherosclerosis, AS. um, so we know what atherosclerosis is and what it does to us. But one thing that it does is it predisposes a person who has atherosclerosis to a couple of conditions. One is called thrombosis and one is called embolism. Ultimately, they end up with sort of the same issue, but they come from two different places. So thrombosis, thromb means clot, right? So it's a clot formation within a blood vessel, and so we have those tiny little cells called platelets in our body that cause blood clotting, and they are sometimes called thrombocytes, clotting cells, right? So we get a little blood clot in our blood vessel. Remember, some of our blood vessels are like little hairs, right? And so you get a clot of tissue, cells all stuck together like a clot within a blood vessel, and it causes blood not to be able to get through it. It causes an ischemia or a blockage, right? So thrombosis is the formation of a clot, and a thrombus is an actual blood clot. People frequently see this When they're older, they get a thrombus in their calf muscles. It's very painful, and but they get small blood clots in their um, calves. Um, that's typically something when they'll see that someone has some kind of a bad clotting pattern. So that's one thing. A thrombosis is a blood clot formation inside of a blood vessel. We don't want that going to our heart, right? Or to our lungs. These are problems. Another thing, so I said they're similar but different. An embolism also will obstruct a blood vessel, but it's caused by something else. Sometimes it's caused by um, just some air, right? Um, it can be caused by, you know, quite often still a blood clot can be an embolism, but it can be, some of that plaque breaks off, some of that fatty deposits, that plaque breaks off, and it will occlude or cut off blood delivery. A lot of bacteria, other solid materials, right? And so a thrombosis, a thrombotic activity causing a thrombus. Embolism is just obstruction of a blood vessel by a clot or something else. And an embolus is the mass that's carried into circulation. So you can see a pattern here. And then we talk to a blockage. That's a complete blockage or a complete obstruction. Um, Most often a clot, but it can certainly be a plaque or something else. Um, and when you have that complete blockage, we're going to end up seeing that called a stroke. So when you hear people saying they have a stroke, it is a blockage in the cerebral blood vessels, the ones to the brain. Um, so embolism, so thrombosis or a thrombus, a little clot. You may hear people talk about something like a pulmonary embolism. This is when you get an obstruction in the lungs. That's a common one. And then stroke is a blockage to the brain. And how do we treat it? We treat it with anticoagulants. Anti meaning against, coagulation. Coag, right? Anticoagulants. Your book did a good job talking about it. I can't remember. I think there might be a little conversation about it later on. There's really a couple of different versions of anticoagulant. You get immediate action in the hospital. They'll give you one that's very, very fast acting. It's a little hard to manage in the beginning, but you can get sent home with one that you take every day called Coumadin or warfarin. One in the hospital is called heparin. It's usually delivered intravenously, but there are some that are intramuscular. Um, and the good thing about heparin is it works very fast, and then it's done. Coumadin is the one they send patients home on, warfarin, and now there's some that are um, um, even less frequently and not it may be daily, but it doesn't need to be monitored like Coumadin does. Coumadin works by blocking your ability to produce vitamin K in your body or use vitamin K to make clotting cells. Um, I was just thinking about something though. Also, the other thing, stroke can be treated if someone knows right away. So you see those symptoms of a stroke all the time. Someone loses their speech. They maybe have some vision blurring. They may see some drooping in some facial muscles, things like that. Um, they can send someone to the emergency room if they think someone's having a stroke. They can give them a drug to like break the clot down really quickly, or the embolism, whatever the stroking activity is caused by. They can break that down really quickly and hopefully save them. All right, so let's talk really quickly about a couple of other diseases. An aneurysm, blood vessels, I've talked to you about this now. They contract or they can get big, they can dilate, right? Um, but they're just cells. They're cells. They're a relatively thin layer of cells. Arteries are bigger. They're stronger, but not all of them. But still they're thin, right? And they're hollow. And so if you get a little weak spot in the cellularity someplace, the artery, as the blood pumps through at a very high rate, the wall sort of balloons out. So you know that if you are blowing up a balloon, you blow and you fill it with air, 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 air. At some point, what happens? It breaks, right? Because it's too weak to continue just keep taking on more blood or more air. Same thing with an artery. So if you have someone that really high blood pressure coming out of the heart, um, if you have a weak artery, a little piece of the wall of the artery, what happens? The artery bursts and people bleed. And arteries don't stop bleeding very easily. So um, sometimes they're caused by, damage from atherosclerosis. Sometimes it's just something you're born with. You have a malformation and people don't know it for a very long time. And sometimes it's caused by injury. Um, there is a disease sometimes you hear called a dissecting aneurysm. That is a massive rupture to a blood vessel. And if that is happening, they can sometimes do a little graft onto the blood vessel, take a little bit of blood vessel and kind of sew it on and strengthen up the aneurysm. Um, I think when people talk about aneurysms, they really see them like if they're in the brain. It can cause a lot of bleeding into the brain because the brain is so heavily vasculated. Um, Another disease is called hypertension. It's just high blood pressure. That's what you know it by. Um, Lots of things contribute to high blood pressure. Um, People with kidney disease, poor functioning kidneys. The kidneys are responsible, and I can't go into this here. The kidneys are responsible for majorly how much water we retain in our body. There are signals within our kidneys that say keep more water, release more water. So kidney disease and not being able to effectively manage that signal from our body can cause high blood pressure. Um, Endocrine disturbance. So endocrines are those chemical messengers. Well, guess what? One of the chemical messengers tells the kidneys what to do. And so if you have an endocrine disturbance, maybe you have a tumor of the pituitary or hypothalamus, right? You can end up with an endocrine disturbance, that ACTH hormone. But often we don't really figure out what it is. Someone has primary hypertension. It could be congenital, it could be from something else, but it's hypertension sort of living by itself. Hypertension is once you get up over 140 on the systolic, and the diastolic is over 90. So I say normal is sort of in that less than 130 and under 90 phase. Hypertension causes your left ventricle, that big one on the left-hand side, to get even bigger. And so it ends up causing heart damage over a long period. How do we treat it? Well, let's start with good diet, good life habits, and go from there. We are going to, someone reduces weight, they are going to have better control. They're not going to have their blood pressure is going to go down. You can reduce sodium in your diet. Sodium makes you retain water. And so if you have too much water, then you have a lot of blood that you have to kind of push around, a lot of blood volume. Too little blood volume can make you have high blood pressure as well. So what might we do? We might, depends on what we need. We can have diuretics that will get rid of some of that excess salt we have in our body in the form of sodium. Maybe release some extra water if people are retaining too much water. This is that process in the kidneys that I'm not going to go through. Renin is a substance that's released in the kidneys or activated in the kidneys through that ACTH system that will tell us to either increase or decrease how much fluid we take. And then we can have those blockers, beta blockers, channel blockers, that help our body to not be constricting so much all the time. And it kind of relaxes the blood vessels so that you're not working so hard to push blood through. Vasoconstriction makes it smaller, and so the blood has to really, kind of just the pressure going through those blood vessels gets really fast and it's like, if you're on a highway by yourself, you can drive really fast, but it's because it's one lane and it's just one car. But if it's really big and there's a lot of cars there, traffic happens, right? So it's sort of that, I guess. That's my analogy I can think of. Let's look at a couple of other heart diseases. Heart disease is a broad classification. When we think about most commonly is something called coronary artery disease, and it's exactly what it sounds like. It means that there's plaque formation in blood vessels that go to the heart. The heart needs to be fed too, right? And so if the heart tissue is not getting enough blood because of plaque and narrowing of blood vessels, what happens? Heart tissue is damaged or dies. And so we end up with heart disease. An early sign of heart disease and this um, narrowing of the blood vessels is chest pain. So we call that angina or angina pectoris. Other signs is diaphoresis or dyspnea. And so diaphoresis is just sweatiness, sweating all the time. Yeah, sweating buckets on a little bit of exertion, or dyspnea, shortness of breath. We diagnose it a bunch of different ways: EKG, electrocardiograms. We're going to look at the electrical activity of the heart. You can have a patient undergo a stress test. They can do it either having someone exert physical activity, or they can actually give a chemical that tries to, cause stress to the heart to see how the heart responds to, increased activity and increased need for oxygen. You can do something called a coronary angiography, which this is the picture that you see from your textbook. That they will inject a dye and they'll be able to look and see the dye in the heart. And you can see here's a blood vessel, right? And then see how it constricts right here and it gets very, very small. That little thing right there is a real problem. Um, Echocardiography, echo is for sound, graph is to make a tracing of it, and heart, right? So they can do echocardiograms to see how the heart is working, and they'll be able to look at it. Your textbook, and I didn't have a picture of it, I'm sorry. Your textbook also on page, I'm just grabbing the page here, had a nice picture that was associated with the angiogram, angiography, I'm sorry. Where did it go? I lost it. Um, that looked at the surgical treatment associated with it, a cabbage, um, a CAB. Is it on the next page? Yeah, here it is. Oh, there it is. It's on page 330. I put it in here. Oh, I didn't go far enough. There we go. So at the top of the page is the coronary angiography, and down at the bottom of the page it shows how they can do how they'll do a PTCA. A PTCA is a angioplasty, so it's a repair of the blood vessels, and um, they'll put a little teeny, they call it a balloon catheter, so they put a little tube in that has a little balloon in it, and they basically inflate it, and they break apart the area where the plaque, where the blockage is, and it provides free flow of blood back through the vasculature. So that's a good picture. And then on the next page is a picture of something we call a stent. That's not on here. A stent is where when they do that that angioplasty, um, if the walls are damaged, they can put like a little mesh in there that will kind of just expand the blood vessel back up a little so that it will um, open up the blood vessel. And then a bypass is on page 331, and a cabbage. Cabbage is the coronary artery bypass graft. And so it'll take a little bit of another vein from your body, and they take out the damaged piece of the blood vessel, and they'll sew back in, they'll suture in a piece of blood vessel from someplace else. So a lot of times they take it from something like one of Cephanus, great Cephan, no, Cephanus, Cephanus. Sorry, Cephanus. I can't even think. Um, One of the femoral veins, basically the great Cephas. I can't talk today. Um, Cephanus vein. I can't talk. I'm sorry. Anyways, bypass. They take a little bit of a vein, they put it into another vein, sew it up, you have good flow again. All right, a couple of other diseases of the heart. We often hear about people having a heart attack, right? The real word for that is a myocardial muscle of the heart infarction blockage, right? So it's a heart attack. Um, it is, usually we see it in men. Of course, all the studies were in men initially. Was that pain radiating down your arm? You turn pale, you're sweating, nausea, fatigue, anxiety, you know, difficulty breathing, and feel like a sensation almost like heartburn. Um, in the chest, in the bottom of the chest. That's for men. Women don't get this typically. Women, what they see is they do see the pain in the jaw that we see here, less that down the arm thing. Women, they tend to see it a lot of times, and it's not here. They see that you feel pain about around the back of around your back. Um, just a general feeling of kind of not feeling good. They'll feel bad for a few days. Women do not have that. Typically, don't have that. Um, they can, but it's not always that thing that sends people to the emergency room. That, oh my God, I have the radiating pain down my arm. It's a lot of these other symptoms, the nausea, the fatigue, um, the dyspnea, but also it's a lot of times a radiating pain in the back. Myocardial infarction is diagnosed a couple of different ways. There's a good lab test. This is the old-fashioned one that they talked about in the book, creatine kinase. Lots of things do this. It will be increased. This MB stands for muscle brain. It's one version of 3 of creatine kinase we can study. And so you'll see an increase specifically in this component, MB, CKMB. But more importantly is troponins. Troponin is a very fast, it's a protein that gets released from heart muscle very fast, as does creatine kinase. Creatine kinase takes a little bit longer. We see this within, really just a few hours after a heart attack. So by the time someone gets, I think I'm having a heart attack, they get sent to the emergency room, within a couple of hours, their troponin level is going to be really spiked. Good news about this is it stays that way for a while. We can detect it. You can say, oh, someone, they go to their doctor on Monday, and the doctor can do this blood test and say, oh, guess what? You had a heart attack on Friday. Creatine kinase, you can't always. And so they can look at the EKG, they can see how that rhythm of the heart is doing and if there's an interruption in the rhythm. How someone recovers from a heart attack is based pretty much on how much damage caused to the heart, right? So that's why if you ever hear someone saying, oh, I think I'm having a heart attack, call 911 and just get them there. All right, a few more. Arrhythmia is an irregular heart rhythm. It's 2 terms we talk about, bradycardia and tachycardia. We think about tachycardia all the time. That's a really fast beating of the heart. Bradycardia is slow. It's a slow rhythm of the heart. Fibrillation is very, very fast, but fibrillation is different than bradycardia and tachycardia in that the rhythm of the heart is out of sync, and it's very ineffective. The heart, you may have a lot of the heart rhythm is very fast, but it's not producing a lot of output from the heart. It's ineffective. And so what they'll do if someone has fibrillation is they'll do a couple of things. They'll put in a pacemaker, another pacemaker, not just that node, right, but a real pacemaker that will provide electrical stimulation to the heart for, another 10 or 15 years, and then they replace the pacemaker again, and it'll keep going. So they'll put an artificial pacemaker in to keep the heart in rhythm. They'll do something called a cardioversion, or, we see this a lot in the movies, defibrillation, electrical current. It does the same thing. It's you try and shock the heart, either with drugs or with a defibrillator, back into the right rhythm. It frequently will work for a while. If someone has underlying reasons for atrial fibrillation, it only works so long. CPR, cardiopulmonary resuscitation, that will get someone back in rhythm. But an ablation is a surgical procedure where they basically damage and make non-functional some of the very specific AV bundles that trigger the contraction of the heart muscle. And so if you can damage some of them, if they're overactive, it hopefully brings someone back into rhythm. I'm not going to go through the case study here. I'm going to let you guys go through that. All right. I'm going to finish up heart disease and then I'm going to take a break. Let's see, I'm actually going to take a break right now and keep the video. I'm going to pause the video for a few minutes and come back to it. And so let's move on and keep going with this from heart disease. Heart disease, is we had just talked about, included, sort of general myocardial infarction and things like that. Other kinds of heart diseases that we talk about are things like heart failure, and this is one where the heart really stops functioning at its capacity. It will, damage to the heart causes it not to, during the contraction phase, it's not pushing all of the blood out, so it doesn't empty fully. This can lead to the heart to swell. We call that edema, or cardioedema. It will also quite often lead to edema in other parts of the body because you're just not able to circulate the blood around the body properly. How do we treat people with it? They put their feet up, give some support to the heart. They can give them some drugs to help assist with this. They will do things like give them Lasix, a diuretic, to help reduce the amount of blood volume. Hopefully control it with some disease, with some diet. But it is when someone goes into heart failure, it's quite problematic. It's things aren't good. Congestive heart failure is one of those, but medications can be quite effective for many, many years if it's treated. If it's not treated, patients will eventually succumb to it. But there are early forms of heart failure that can be treated. So if you hear someone say, "Oh, I had a cat once that had cardiovascular related congestive heart failure," and he was on medication for a really long time and he did great. I have a relative also that I don't, a lot of times I tell stories about my family, but not today. Anyways, diuretics help, medications help, diet helps. Other things, people are sometimes born with congenital heart diseases, birth defects. A common one is that septum that is between the two ventricles. There's a damage there and it's not fully formed, so that it makes it difficult. And there's a couple of others. The other one that we probably see the most common is the murmur. People have a heart murmur, and it's something the doctor will just monitor for a period of time. Most congenital heart defects, it's a defect in the structure of the heart and it needs to be corrected surgically. Rheumatic heart disease is an interesting one. This is one after someone gets a strep infection. You've heard of things like strep throat. Well, streptococcus is a kind of bacteria, and it, interestingly enough, the body identifies kind of the mechanism by the way the immune system identifies bacteria as something foreign, a pathogen. There's a structure on the bacteria that's very, very similar to a structure on our heart muscle. And so our heart muscle, sometimes our immune system sometimes thinks our heart muscle was that bacteria, and it produces a sort of an autoimmune response to it. So it will, there's one that comes after a strep infection. That's one thing that can happen. It's an autoimmune disease, but the other is streptococcus can also just affect the heart valves. So it's two different things that are associated with strep infections. One is rheumatic heart disease, which is the actual streptococcal infection that damages the heart valves. The other, and gets treated with just regular antibiotics, and they go on their way, and they're hopefully good. And there's some that are post-streptococcal. Other disorders that we see, varicose veins. Remember we said about those one-way valves and how when they don't close all the way, the blood starts to pull back. That's what we see here. So blood is coming back from the toes up to the heart, and it goes in a vein, and it goes up and it slides down and it makes a little pool. It goes up, it slides down, and it makes a little pool of blood. Those are varicose veins we see. And so they end up with kind of a chronic dilation. Obesity, hereditary, genetic issues. People that stand on their feet all the time, they end up with a lot of damage to their vasculature. Pregnancy is another one. What do we do for it? They can remove the portions of the vein that are not good. Remove the varicose veins. You still have plenty. But you can also do things like wear really tight compression socks that helps the blood to move back to the heart effectively. A couple of other disorders. These are not disorders of the heart, but rather disorders of the vasculature. Phlebitis is referring to the veins, right? And so itis is inflammation, so phlebitis is inflammation of the veins. We see this a lot in people that have had an infection. Um, Other things, if someone has bad circulation, their heart's a little not working quite as well as it should, valve damage, all those things. So we can see some of those that inflammation of the veins through any of those things. The problem with phlebitis is because the blood is kind of pooling, it's almost in the same idea as varicose veins, that you get these little pools, and this inflammation kind of triggers things in your body, and you end up getting blood clots in those lower extremities. And sometimes we can call them, that's called thrombophlebitis if it's an inflammation caused by a blood clot. Sometimes you'll hear them called a deep vein thrombosis. Those are sort of what we were talking about when we were talking about a thrombus in the calf. We see this often, this DVT or deep vein thrombosis in the legs. Let's look at a couple of the key terms related to vascular disorders. I think we have seen all of those. We have seen the CVA is another word for stroke. It's the brain is not getting its blood fluid. Clubbing we didn't talk about. Clubbing is when you get sort of that bad circulation that we just talked about that we see with phlebitis sometimes. Same idea. I mean, you get really big sort of ends of your fingers and your toes. So coarctation of the aorta is a little bit of a narrowing. That's kind of in the weeds. I don't know that we need to worry about that as much. C-reactive protein, I think a lot of us hear about this. C-reactive protein is a major marker of the immune system, of inflammation. And so when someone has pericarditis, or they have phlebitis, anything that's kind of an inflammatory response related to the heart, their atherosclerosis, their C-reactive protein is going to be up, 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 and that's telling us that patient has inflammation and we got to deal with something. C-reactive protein is a protective protein, so that when you have it circulating, it's a problem. Cyanosis is something is lacking oxygen and turns, we start to see blue in the lips, blue in the fingernails. We just talked about DVT. We talked about diaphoresis, dyslipidemia. We talked about these. We talked about all of these. We talked about all of these. We didn't talk too much about patent ductus arteriosus. This is a defect in the pulmonary artery. So it will affect the blood flow in a young baby. Rheumatic heart disease. This is what we just talked about, group A strep. Let's see, septal. Okay, we talked about that. Shock, stroke, syncope. Syncope we've talked about before. That's just fainting. Fainting when something happens. It's you have people faint for all different kinds of reasons, but inadequate blood flow to the brain is what happens. So sometimes if people have maybe they don't like to watch a certain kind of a procedure or something that just makes your brain sort of poof, and you get what's called vasovagal response. Your nervous system just kicks in and it sort of drains the blood from your head. You go down for a quick minute and faint. That's that. Okay, and so some more. We talked about ablations, pacemakers, cardioversion. I think we talked about all of them. We talked about a stent. Yep. All right, let's quickly go through the lymphatic system because I know I'm talking an awful lot here and this is getting very long. The lymphatic system is analogous to the circulatory system in that its job is to take the fluids and the proteins from all the tissues in your body and kind of bring it all back into one main stream called the lymphatic system, and then we transfer from the lymphatic system into the bloodstream so that it sort of cleans up everything that's in your tissues, and sends it through for cleanup and for use and all that good stuff. The lymphatic system has a couple of other functions. It's definitely a cleanup issue. It definitely helps to clean the body fluids, and it also aids in digestion. You always hear people talking about lymph nodes, but we typically see them around the neck, the armpits, in the chest, in the groin. These are all places where lymph, that fluid, so just like blood is inside of a blood vessel, lymph is the fluid inside of a lymphatic vessel. And so it drains into, by sides of your body, into the left or the right lymphatic ducts. And so the lymphatic system is a series that, is connected by these lymph nodes, and you can see all these little lymph nodes, and again, just little clusters of cells, right? But there's lots of places that we see it. We see it in the tonsils, the thymus gland, which we are going to talk more about when we talk about immunology. The spleen. The spleen is an organ that is, it cleans up your blood, and it's a site where we see, I don't move this out of the way, it's a site where we see our immune system interact with pathogens in our blood. So it's a good place for us to, and in lymph, and it's a good place for us to be able to see if there's anything kind of pathogenic kicking around that we need to fight off. The appendix, we don't think about that much anymore because I think a lot of people think that it doesn't do anything. It does have a purpose in the lymphatic system that is it's associated with the large intestine. So it is a place that you can see a little bit of lymphatic activity because of, obviously, we're talking about digestion, right? So the appendix does play a role in the lymphatic system. And Peyer's patches are interesting. Those are tissues in our abdomen, and they're sort of a site where lots of we talk about sort of the good bacteria in our body and some of the systems that we have. There's a series of tissues in our gut that's kind of a mucosal activity, and kind of wet and gross, and bacteria like to live there, good bacteria like to live there, and it makes it so bad bacteria don't infect our body as much. So really, it's a lot for med term class, so we're not going to spend a lot of time on it. Just be aware that's that kind of tissue in your abdomen near the intestines that it has an immune function. And so basically, in general, the lymphatic system drains all the fluids and proteins out of your tissues and helps us get it back into the bloodstream to go to do what it needs to do. And so I think we talked about all of this. Okay, let's talk about a couple of clinical conditions associated with the lymphatic system. And you can look at this as you go along. So lymphadenitis is enlargement of the lymph nodes or inflammation of the lymph nodes. Lymphangitis is inflammation of the lymphatic vessels. Lymphedema is obviously tissue swelling at the site of a lymph, wherever the lymph is, or if there's a couple of places where you see it. So if someone had a removal of lymph nodes are sort of the storage space for lymph. So the lymphatic system is a whole series of, vessels, lymph vessels, but the lymphatic nodes are places where, you can stop and store some of that fluid. And so if you have either removal of some of those lymphatic vessels or lymphatic nodes, the lymph doesn't have a place to go and it stays inside the tissue. And so you get a swelling of the tissue. It can also happen if you have some kind of a event, a thrombotic or an embolytic kind of event that blocks the lymphatic vessels. Lymphoma, oh, that's a disease. It's a cancerous disease, and so lymphoma is a tissue mass affecting lymphoid tissue. And so we don't really need to go, I think this is a little bit much. Perfusion, whether it's lymph fluid or it's heart or it's blood, perfusion is just how fluids pass through either to organs or tissues. So we tend to think of organs as being very bloody and tissues, but organs are also tissue where the lymph aggregates from. We're not going to do the arterial sense. I think that's a little bit much for a med-term class. Let's see, I'm just looking at tamponade is one where the heart sounds are kind of muffled because there's a lot of fluid, there's a lot of inflammation and fluid buildup in the pericardium, the pericardial sac. So it sounds, when you hear someone has a cardiac tamponade, it's kind of a muffling of the heart when you're listening. Ectopic beat is one that originates someplace in the heart other than where it's supposed to be from the SA node. A flutter is, it sounds nice, but a flutter, oh, someone has a heart flutter. It's not quite fibrillation yet, but it's irregular. It's an irregular contraction, very, very fast though. So it's not quite considered fibrillation. They call it a flutter, just, I think they do that not to scare people, but it's similar. And hypotension, just like hypertension is high blood pressure, we didn't talk about low blood pressure. Hypotension is low blood pressure. Usually people are dehydrated. That's probably the most common symptom. You're dehydrated, you don't have enough blood fluid, and you're not, you just don't have enough. Your blood pressure is very low. Let's see. Intermittent claudication is a pain in your muscles, and intermittent says that it's occasional, right? We're not going to go over prolapses. Raynaud's is an interesting one. Raynaud's is, some people may have it. It's actually fairly common. I have it. I know a lot of people that have it. The blood vessels in your arms and your legs and you especially feel it in your fingertips, your toes, any kind of extremity. You have a disorder where your blood vessels constrict really, really tight, and you get it's very painful in your fingers and toes. A lot of times it is related to an autoimmune disorder. Regurgitation, people use that term all the time. It just means to the backflow. Oh, we're in enrichment terms. That's why some of these are crazy. You can look through these and see, but I don't think there's any of these that you really need to know other than this is where you're heading. If you're going to go do something in cardiology, make sure you spend some time here. But for the most part, these are getting to be, these are in the enrichment term category. I didn't notice it. You can look through them though. Some of the abbreviations, there's a lot of them. So we sometimes hear about that ACE inhibitor, the angiotensin converting enzyme. This will help people with blood pressure issues and cardiac issues. Atrial fibrillation we've talked about, so AF or AMI, acute myocardial infarction. Make sure you take a look through these and understand these relative to the discussions of the diseases of the heart and the lymph that we talked about. These are in your textbook, so make sure you go through these abbreviations. Cardiovascular disease in a medical note, you may see CVD a lot or CVA for a cardiovascular accident. Very common. HDN is an abbreviation for hypertension. That we see a lot. High blood pressure. LDL, low density lipoprotein. That's, that lipid fat that lipid protein complex that's really not good to have in high numbers in your body. Let's see, there's a lot here. We're not going to go through them all. And so the health profession that we're talking about today is someone who works in a vascular lab. Vascular technologists are patients, obviously, looking at the vascular. They're evaluating the blood vessels, see how they're functioning, see how they work within the cardiac system. And they are required to have certification. They have to have a clinical practicum experience. And it's either a 2-year or a 4-year degree program, depending on where you go. And the patients that we see often in a vascular lab are people that are quite elderly. Over years, gets harder and harder as you get older and older. All these things don't work quite as well as they once could have. Patients that maybe have had high cholesterol for a long period of time, they were long-term smokers. There are lots of places where you can see vascular issues that develop, and it usually comes from sort of long-term exposure to whatever the offending substance was. And that's it. Thanks for sticking in. I know it was a long time. It's a big chapter.